It's a huge privilege, and has been, to be a member of the Lucian Leape Institute over the past many years, and to partner and collaborate with Lucian and my colleagues in the Lucian Leape Institute. I'm looking forward to the future of the Lucian Leape Institute. I think we have a very bright future. We have a lot of work to do. We've made some progress on patient safety, and yet we know we have so much more that we can accomplish. And so we've begun to formulate our agenda. The members of the Institute, including Lucian, spent some time together earlier this year mapping out some elements of a game plan going forward. Our focus is really going to be how we actually make it happen. I think we've done a good job in partnership and along with many others across the country in understanding what we need to do. And now it's really how do we shift the focus to how do we make sure it actually gets done. And that's critical. It's on behalf of our patients and our communities, and we must have safe care and potentially defect and error-free care here in this country. We believe that unless we shine the brightest light on the current state, unless we are totally transparent in looking at how care is delivered today, we will never be able to improve it. And so transparency has multiple dimensions, as we've outlined in our report. I think transparency amongst caregivers is critically important to improvement. Transparency with patients and families continues to be critical. Patients and families can be and are very valuable partners in ensuring safe care. And so that requires free flow of information. It requires a trusting, honest dialogue. It requires the respect that's so important amongst all members of the care team, but also respect for patients, families, and the public, needing to know, needing to understand the way things are today, help them make intelligent choices, and then use all of that to fuel our improvement engine. I think transparency has not been ingrained in our culture over time, and that's, multifactorial. Medicine is complex, and perhaps more complex than ever before. It makes things quite difficult to understand, but I think we don't want to fall back on that going forward. We need to simplify. We need to ensure free flow of information. We need to engage with patients, families, and the public. And I think there's been hesitancy to consider that historically, but I think the cat's out of the bag. I think transparency has to be one of those foundational elements. It's one of the reasons that the Institute identified it as one of our 5 transforming concepts, and in many ways is the most foundational because it fuels our joy in meaning in work and workplace safety efforts, our graduate medical education and medical school curriculum development. It's also foundational to our patient and family engagement work, as well as all the care integration work that needs to happen. So transparency is really the kind of the floor, and at a minimum we have to tell the truth, and we have to ensure the free flowing of information. Join us in this effort. The leadership of the healthcare delivery system in this country has a unique role to play. I don't think we have any business talking about quality unless we can ensure the safety of our patients. It's really the foundational element of quality, and it's a movement. It's a movement that's going to continue to grow, and I'm excited about the opportunities, and I hope my fellow CEOs will also share in this work and make it a priority for themselves and their institutions.